Researchers claim that there is an overall link between oral health and overall health. It is said that 20% of gum diseases actually lead to heart disease. And doctor, tell me, I'm a periodontist now, and maybe you can explain why is it that the inflammation in the gum disease causes a narrowing in the arteries?
There have been a lot of studies that show that there is some degree of association between periodontal disease and heart disease. The easiest way to explain to patients is that if you had a knife sticking through your stomach, you wouldn't actually leave it there. So a tooth is actually a similar scenario where it sticks through the jaw and is a portal for bacteria to gain access to the main bloodstream. Yes. That's called a bacteremia. And the studies have shown that while there are cases where there's a particular protein, C-reactive protein, which is elevated in patients with arterial diseases, it's not related to bacteria related to heart disease. And they find that patients with a high risk of periodontal disease or high severity of disease do in fact produce high levels of C-reactive protein. Periodontal disease is considered an overall umbrella for several types of diseases in the mouth, but gingivitis is what most patients are familiar with.
All right. And we do understand that gum disease will affect the gums, will affect the teeth, and will affect something the bone structure.
Right.
But this correlation, what are some preventative checks that patients can take to reduce their risks?
Well, oftentimes the dentist is the first point of noticing something in the mouth that may arise and lead us to think there's something systemic taking place. So we do advocate that patients see their dentist at least once a year, at least every 6 months in some cases, and it basically depends on your level of risk. The dentist would do a risk assessment to find out what your need is. When that happens, as a general population looks at disease, the first sign of gum disease is bleeding of gums. So if your gums are bleeding, something is wrong. Also, a change in position of your teeth, spaces developing, changes in alignment, swellings or abscesses developing in different parts of the mouth can indicate that there's some underlying systemic problem.
Well, I have a confession to make. Because while you were talking, I was actually taking my tongue and doing a little systematic check there to see if there's any movement in my alignment. So, doctor, we do thank you for this information.
No problem. Thank you. Thanks for having me.